Bé, bon dia a tothom.
Good morning, everybody. Good morning, and thank you very much for being here. Thank you for inviting me to participate, and thank you, Tim, for being here, because we're really looking forward to listening to you. Before starting, Tim wanted to share a few words with us, right, Tim?
Buenos dias. Es un placer estar aquí a vous. Great. And gracias, Arrels Fundació. It's really a pleasure to be here and get a chance to meet you and talk about housing first.
It's a good beginning.
Yes, good.
Bé, el Tim Aubry, us el presento.
Okay, let me introduce Tim Aubry to you, so that we all know who he is and what he does. He's a professor at the University of Ottawa at the Department of Psychology, and he's a researcher about the Fidelity to the Housing First model, which is the topic we will be dealing with here in this session. He's currently a professor at the University at the Faculty of Social Sciences about community health. Throughout his career, he has collaborated in research projects together with organizations and the Canadian government. He has contributed to the development of programs and social policies. So, once he has been introduced, I believe that the first thing Tim wanted to do, and I believe that could be very useful and clarifying, is to tell us, to start, about his own personal experience in Canada with regards to the model and the fidelity to the Housing First model.
So just to give you some context in terms of where I'm coming from, as Toni mentioned, I do work in community mental health, and one of the issues that has preoccupied us in mental health services in Canada has been transitioning from having large psychiatric hospitals to their closure to developing community services. And this has been going on in Canada for over 30 years now. But we have not done a very good job in this area. And so I've really, over the course of my career, I've been very interested in the development of these community supports. And of course, housing is critical. It's kind of where everything starts when we talk about community mental health services. And in 2008, for a number of reasons, there was a development of a national body in Canada called the Mental Health Commission of Canada. And it was on the heels of a large study that was looking at the state of mental health services in our country. And one of the things that was highlighted in this study was the large number of people across Canada with severe and persistent mental health problems who had no housing, who were homeless. And the report in launching this commission, this new organization, really said that had to be an important focus in the development of new services, new mental health services to respond to the needs of this population. And shortly after that, the federal government committed a large amount of money, $110 million, which would probably be about maybe 80 million euros, for the Mental Health Commission to do a large study, what we call an intervention study, meaning that you would look at how to respond in an effective way to address the issue of homelessness among people with these severe and persistent mental health problems. And that launched what we called the At Home Chez Soi study, which was started in 2009. It was a very large study, and our initial work when we looked at the state of the research around responding to homelessness, we wanted to bring in and test what we thought was the most promising approach to addressing the issue of homelessness in this population. And that's where we identified the Pathways Housing First model that Sam created, founded in New York City, that already had been around for a couple of decades, starting in the early 90s. And it really had some promising research behind it. Sam's group had been publishing studies and had done some really good research. And we thought this should be the starting point. Why don't we look at, with this project in At Home Chez Soi, test a Canadian version of the Pathways Housing First project. And that's what we did for over 5 years. We completed the study in 2013. We followed over 2,000 people in 5 cities, 5 Canadian cities that were very different. Some of them were small. We had the largest city there, Toronto. The composition of the populations was quite different. It varied from Toronto, which is very diverse, a wide mix of ethnic cultures. Winnipeg, which has a very large proportion of people with Aboriginal backgrounds who are homeless. So we were really going to look at and test Housing First in a whole bunch of different contexts. And that's what we did. And what we found was, in following these people for 2 years, comparing people who got Housing First to people who were getting anything else in the community but Housing First, what we called standard care, there was a huge difference in the results. People in the Housing First group, they exited homelessness. They exited homelessness rapidly for the most part. And as Sam mentioned, we found over the 2 years that there was success with 3/4 to 80% of people who were receiving Housing First. In comparison, people who were receiving other services in the community, the success rate was only half that. It was in the range of 30 to 40% of those people were exiting homelessness. Now that's a huge, huge effect for a community program. We also found that people who, in exiting homelessness, people in the Housing First community were improving in their quality of life significantly more. They were reporting a higher level of satisfaction with different areas of their life, obviously their living situation, their leisure, their finances, more generally how they felt about their life. It was much better and quicker improvements, again, than the people who were receiving these other services, the standard care. And then the other finding, which was important, was people receiving Housing First had greater improvements, quicker improvements in terms of their community functioning. They were just doing better in the community. They were starting to build a life in the community. So this was an important study. When the government commits that kind of funds to a study, and at the same time as doing the research, we worked closely with government, both at the federal level, which would be like the national government, but also at the provincial level, or kind of the state level governments, because we really wanted to use this research to kind of launch a Housing First effort and initiative across the country. And that is what's happened since 2009. Canada has taken on Housing First, is prioritizing Housing First as the approach to address homelessness for people who experience chronic homelessness and who have significant mental health problems. Part of the study, an important part of the study, it wasn't just testing whether it was making a difference, but we also wanted to open up what we call the black box of the program. We wanted to be able to say, what are the key ingredients to a Housing First program? And how can it be adapted to different contexts? So we put a fair bit of effort as well, not only in the outcomes of the participants, but also in what we call the implementation of Housing First. And that's what I was going to talk to you today, and Tony's going to ask me some questions, just to give you an idea of what's in that black box of Housing First.
Bé, fantàstic. Jo crec que...
Great. After this detailed explanation of the context made by Tim, maybe we could start in the fidelity issue. How do we measure fidelity, Tim? What type? I mean, there is a poll, there is a survey about this that measures the degree of fidelity or the heterodoxy or orthodoxy. I mean, what are the recipes that are prescribed? So I'd like to ask you, Tim, could you tell us what do you refer to when you talk about fidelity? What does fidelity mean and how is it measured?
So this is kind of an emerging research area, what we call program fidelity. There's an area in the research world, you know, for eggheads like myself who do research, that's called implementation science. And what that means is, if you have a program, a community program that you offer to people that's making a difference in their lives, that's helping change their lives, that they derive benefits, what are the critical elements that have to be in place for that program to produce those outcomes? Okay? And that's fidelity. I mean, people will use terms like its standards, its components, its ingredients. But all it means is breaking it up. Now, Sam has talked to you about all sorts of elements to the Housing First program. You know, when we talk about things like a rent supplement, where people are only paying 30% of their income on their rent, on their housing rent. And I'm going to walk you through the different parts or domains of fidelity in terms of Housing First. But let me say, first of all, why is program fidelity important? Well, as I mentioned, we wanted to test Housing First in Canada, and then we wanted to diffuse it. We wanted to bring it to other communities in different parts of Canada. Well, to do that, you need a recipe about what makes up the program, because you want to train people to more or less put that program in place in the new community. And typically, and this was the case in Canada, incidentally, in the 5 cities, the staff who were in the Housing First programs in these cities, they had never worked in a Housing First program before. They were starting at zero. And that tends to be the case. And often people are coming from other types of programs where they've been trained in all sorts of ways that can even be counter to Housing First. So the idea of program fidelity, it plays a really important training role because you're training people towards those standards, okay? The other thing that it does is it allows you to assess along the way the extent you're offering something like Housing First, okay? So there's a chance to evaluate and improve the programs. Once people are trained and they're in the community and they're providing Housing First. In our Canadian study, we followed people for 2 years. The data collection, it was a 4-year effort. We actually assessed program fidelity 2 times for each of the programs. There were 14 Housing First programs in the 5 sites, okay? And you can do that. You can measure fidelity. Now, in your booklets today, there is the measure of program fidelity. It's a 41 measure, so that that's something you can certainly refer to as we're doing this interview.
Jo per fer-li la següent pregunta.
In order to ask you the second question, I'd like to read out briefly the 8 principles of housing first, at least the 8 principles I have here. And I'd like to contextualize. Housing is a human right. Respect for all user people, the commitment to work with a person until that person needs it, individual and independent housing, separation of housing and treatment, the right to decide by the person, oriented towards the recovery of the user, the reduction of the problems, to minimize problems out in the street. And then 3 additional points. About what is not housing first? First, it doesn't mean to focus only on housing. It is an integral way of acting. Secondly, it doesn't mean working or living in shared flats if it's not the decision of the person, or to change apartments often for logistic reasons. And thirdly, in the case of people with addictions, it doesn't imply to stop drinking or consuming. First, the house. First housing, and then we will work on the other issues. Based on this, and on the other potential components or characteristics of housing first, I'd like to ask you, Tim, does it only the models that show the greatest fidelity work?
Okay, good. You're a quick study, Tony, in terms of housing first fidelity, I must say. So let me answer this. Let me get into a little bit about, like Tony presented the principles of some of the main principles that guide a housing first approach. Now, when we take it to what we call fidelity, we actually take it to these set of kind of standards that we aim for, that we target, okay? And there's actually 5 domains that the standards fall into. The first domain is just the housing structure and process, okay? So we're trying to offer people regular housing. We talked about the 30% kind of figure that gets made possible because of the rent supplements. We work on things like, as Sam said, inclusion, integration. So we don't want people all living in the same apartment blocks. In fact, there's a standard that there's only a small percentage of people who will live in the area. And that's kind of the housing structure and process. And then we also talk about the separation of housing and services. We don't expect people to have to pass some kind of test that says they're housing ready. That's one of the standards. There's no preconditions, okay? The services go where people go. So if people lose their housing, they continue to receive the support, okay? That's separating housing and services. And there's a commitment to rehouse. Again, those are standards under that area. Then there's philosophy, a service philosophy. It's an approach that has very, what I would call, strong values behind it, okay? Now, Sam put a lot of emphasis on client choice. You want people to regain some control of their lives. The longest time people have been telling them what to do, and they've been marginalized, and they have no control. They have really no power to do the things they want to do. So that's an essential part of the service philosophy. Harm reduction, which I think you're very familiar with here in Spain. It's not abstinence-based. You work with where people are at, and you work on the issue of addictions kind of in a staged approach. And you let people, you know, as Sam said, you follow people. You try to motivate them to work on that, but it's a collaborative kind of approach. And then there's a concept now that's really important in mental health services in Canada that's really being promoted, and the term is called recovery. Okay? And you'll see that in the literature. Now, the idea of recovery for people with severe and persistent mental illness, it's not that they're going to get necessarily past the illness or the symptoms. Those will come and go, and there'll be good times and bad times. But what recovery means is, it's like a lot of disabilities. People find a way of adapting and coping and building a satisfying life in the community. And that's what recovery means. They can pursue their goals, their dreams, the things that are important to them. So that's a central value that's part of the program philosophy. And then we also have service array as a domain in program Fidelity. So these programs, they try to offer a range of services. I mean, case management, you know, there's certainly crisis intervention, but there's beyond that, there might be some counseling. And if you can't offer it within the team, you try to access it in the community. So this is where you get into when people are ready to pursue employment or schooling, to consider going back to schooling. Okay, so those are standards that you look for in Housing First programs. There's a chance as part of the services for people to work on their physical health. So primary care and nursing can be part of the service array. Okay? And then finally, there's the program structure. So how is the program set up? So if you have a group of case managers, how many people do they serve? How many people do they help? Now, the standard in Housing First is if it's case management, so people have individual caseloads, it's about a 15-to-1 ratio that you target. Okay? That would be high fidelity. If it's a wraparound service, this assertive community treatment, which is more intensive, it can be as low as 10-to-1. Okay? So that's in there. In program structure, Sam mentioned having peer support workers. That's a standard of fidelity. Now, here's the thing. In the measure that's in your booklet, there's 41 different criteria. And it's part of a survey, and I'll talk to that in a little bit about how that works. Programs don't get 41 out of 41. It's impossible. In Canada, we had good fidelity. We were able to meet about 70 to 75% of the standards, of the criteria for Housing First. And it's going to vary the ones that you meet and the ones where you have lower fidelity. It depends on context. When we talk about these kind of programs that start to open up the black box and that have these ingredients, there's kind of this aspiration that you're going to have as many of these criteria met. But the reality is, just because it's such a complicated, messy world when you get into service programs, you're only going to meet some of them at a high level of fidelity. And as I said, you know, we had good results, and we were in the range between 70 and 80% of the criteria in Canada.
Sobre això que acabes de dir,
With regards to what you have just said about the criteria and the questions in the survey, I'd like to ask you a question. But before that, I want to ask you something you have referred to in answering this question. You have referred to the importance of decision-making capacity by the user, of the person that the user, to make sure that the person makes decisions about all of his or her choices, and the importance of the fact that the staff should make sure that this is so. So I'd like to ask you, given that one of the most relevant factors that you have always highlighted when you talk about housing first, which is trusting the person, somebody who receives the support or the help of this housing policy, till where should this trust arrive to? To which extent should we trust that person?
Yeah, this is a good question, because the approach really, there's a term in English called pushing the envelope, which is kind of taking things further than you're comfortable. And certainly around the issue of trust, you really need to do that with people. That's central to the whole approach. You're trying to give people some power back because they haven't had that for a long time, maybe throughout their lives. Having said that, as a service provider, you have a responsibility for the welfare of your client, of the person you're working with. And there are times when people, you have to kind of intervene when people are going down a path that's just too destructive. And I can't, it would depend on the situation, it would depend on the case when you make that decision. But that's the messy part of this kind of work. And again, I get back to this idea, though, you've got to take it further, and this was one of the interesting things. I was particularly involved in a city called Moncton in the Canadian Project, which is on the East Coast. It was the smallest city. There was 100,000 people living there. It had one Housing First team serving about 125 people that was part of this study. And I was involved in the looking at the implementation. I was around when they did the Fidelity assessments. And this issue was very prevalent, watching people who had worked in day programs. They were staff who had worked in inpatient. And they were used to a very traditional role. And they were faced with ethical dilemmas, going into apartments and seeing drug paraphernalia in the apartment. So what do you do about that, this is the issue of client choice. How do you intervene? This was a dilemma that they talked about. And what I noticed over the 4 years that I worked with the program, people got increasingly comfortable with trusting clients, with going further down the road of the risk-taking that Sam talked about. Having said that, there were circumstances where they intervened because it was just too destructive, too self-destructive. And that's kind of the dance that I think as service providers you get into when you're trying to deliver housing first programs.
Do you believe that, okay, that's my second question. How does the program decide the neighborhood or community in which the user will live? I reckon this is an important decision amongst many others that affect the survey and the way to intervene and to act. So, of course, if we actually use common sense, which is not a very widely used sense, that makes us think that, well, maybe the person who wants to be cared for or who wants to get a housing unit, he or she should have something to say about the neighborhood in which they will be brought to live. But that can also imply infrastructure problems, availability problems, etc. Because, for example, I don't know, if in that specific community or neighborhood, the user has parents or relatives or friends, and that would be easier for the reinsertion or the comfort. I mean, these are factors to be taken into account. So, Tim, how do you think we should approach this topic? I mean, about the place, the community, the neighborhood.
Yeah, this is the there's the aspiration of choice and there's the reality of choice. It is one of the standards that people are going to have some choice around the type of housing they're going to live in. And certainly in the Housing First programs in Canada, there were people who looked at more than one unit, and they decided the first and the second one wasn't where they wanted to live. They didn't want to live in a basement apartment. They didn't want to live so close to where the services were and where their network of people that they're trying to get away from, in terms of maybe some of the influences that they weren't comfortable with. But the reality is there is limits because of the economics of accessing housing where people can live. And that was certainly part of the Canadian experiment. But we did want to make sure that people could refuse an apartment. And the reality is, if you've been on the street for 5 years or 10 years, the first unit you walk into is going to look pretty good. What's your reference point? So the majority of people, I don't have the, kind of the statistics on this, but my impression, certainly from, again, being most involved with this Moncton site, was that the majority of people went with the first place they saw. But you want to give people some choice, and often it's not all the neighborhoods in the city. It might only be 1 or 2 or 3 neighborhoods that are possible, because it's where the housing is available and what you can afford.
And with regards to another very important topic related to the first one, should we always tend for the fidelity to the Housing First model, respect the philosophy that it cannot be a shared housing unit?
Yeah, this is, I mean, it actually could be a shared housing unit, okay? If that's what people want, if that's what people ask for, then if you were delivering a pure form of housing first, you would work with people to put that in place. Is it with a partner, a romantic partner? Is it with a close friend? Now, so you could have shared kind of accommodations, and we had a few examples, but the reality is, with the population, most people don't want shared. Sam talked about the needs assessment work that they did to kind of get this program going. And there's been a lot of needs assessments done in North America, in the US, and in Canada, asking people with severe and persistent mental illness where they want to live. And 80% or more of people say, I want to live in regular housing. I don't want to live in group homes or what we call congregate kind of facilities with other people who have challenges and are struggling. And I want my own place. But having said that, there's going to be a minority who may have other particularities of what they want. We had one guy in Moncton who had his own apartment and who didn't like it. He didn't like it. He didn't like being alone. And he convinced the staff that he didn't want the responsibility of having his own apartment. He wanted to move into a rooming house. And the staff went with that. So a rooming house is you get a room and there's common areas. Okay, so they tried to find a rooming house that was okay, that was half decent. But the majority of people aren't going to choose rooming houses. That's kind of the first housing that people can afford after they're off the street. But it often tends to be inadequate. But you know, there's an example of somebody that wanted something that was quite different. Okay.
També acabes de mencionar...
You've just mentioned an aspect that's also a significant part of the survey and the measure of fidelity, which is the link that is not always well solved of combining housing, i.e. housing first, with all of the collateral problems that the person may be facing. Mental health problems, addictions, etc. So, is it easy to separate one from the other? Because let's say that the starting point is that you need to separate both. That housing comes first, and then whatever else. So what's the method that you have created? I don't know if it exists. Or which recommendations would you make to separate both?
There is, as part of the standards, you know, of separating housing and services, and this was what we did set up in the Canadian study, and we do recommend it to programs, that the responsibility of housing be given, if it's a small program, to a particular person, rather than it be shared across the team. That there be somebody identified who takes care of the housing, and the rest of the team takes care of the support. That's an important part of this separating housing. And you can see why, because you know, people get into these conflicts of interest. If you're taking care of the housing, you worry about housing. You worry about the relationship with the landlord. You worry about the relationship with the neighbors. People are paying their rent. They're taking care of the place. And the service providers work on other things, you know, the building the life in the community, people's health, if they want to work on things like addictions. It's much cleaner that way. And certainly that's an integral piece or ingredient of this housing first model. And you're doing that, again, because, you know, getting the housing, you know, put it this way. The support is portable. It's completely separate from the housing. It's not in the housing. It's a separate thing. And so your structure, your program structure should reflect that. That if this housing doesn't work out, you know, the support providers, they'll keep working with the person. They're portable. So that's kind of an important structural piece to the setup.
A mi em sembla que només cal llegir...
Well, I believe that you only need to read, to devote some time to reading about housing first, to reading the survey and reading the presentations that Tim or Sam have prepared, to realize that it's an initiative action with a lot of details. It has been well thought out, very deep, very well structured, with many elements that fit together, and with a lot of people who depend and who devote a lot of efforts to this. You realize that immediately. Do you believe, Tim, that this is a model that could be perfected?
I think it's a model that we're finding out can be successfully put in place in a whole bunch of different contexts. You know, I mentioned cities of different sizes in Canada, different compositions, and now we're finding out, you know, from the successes that are being reported in different European countries around putting in housing place, that, you know, a reasonable level of fidelity can be achieved, you know, in terms of putting housing first in different countries and contexts. Having said that, I don't think we can ever perfect it, because I think these programs, if they're good programs, actually, they're always adapting. They're always getting better. And I think, what we call Housing First today, in 2016, there could be some differences, and I hope some really positive kind of adaptations and additions. Over time, let's say if we look at what Housing First will look like in 2026. Here's the thing. If I were to summarize the Canadian experience with Housing First, we were very pleased with the results. And in fact, it influenced the government. They used our interim findings in Canada to change the national homelessness policy. And they changed it to favor Housing First. So the money that the federal government was putting in to address homelessness, communities now had to use a significant proportion of it to bring in Housing First programs. So, they saw the effectiveness and the success. Having said that, we had some disappointments. We would have liked to have seen larger effects over the 2-year period in terms of how people's lives turned around, in terms of how much they participated in the community, in terms of what we call this recovery thing, in terms of the extent they started looking at things like schooling or even vocational training. And I think one of the areas to improve Housing First is we got to work on how we can make the support more effective. It's a good start, but what a lot of Housing First programs find is they spend a lot of time putting out fires, dealing with crises, and they have a hard time getting to planning people, help with people, collaborating with them on what their dreams are and pursuing their dreams and going after life goals that they weren't able to pursue when they were on the street. And I don't think we've often haven't made that kind of turn towards those kind of services. So I do think we by no means have perfected this approach, but I think we've shown it to be effective, and it's a platform on which we can continue to improve the kind of supports that we're offering in these programs.
Jo et volia fer una última pregunta.
I wanted to ask you one last question, and then you will be free to say anything that has been left to say. My last question is about what you have just said. I mean, the Canadian success story, and the federal government decided to adopt public policies with regards to what you suggested. And you also talk about the need to have resources to face all of this with greater efficiency. Do you believe that public administrations are aware enough about the need for initiatives like this one?
Well, I mean, I can speak from the Canadian experience. I think there's some recognition that when you have people who are homeless and it's visible and the public is encountering them in different parts of cities, and it makes them uncomfortable. I think we're at a point where governments do want to do something, but it's not their main priority. I mean, we're talking about essentially in Canada, less than 1% of the population who are living in this way. So it's not front and center. So what becomes important, for programs like Housing First is the continual advocacy and public education around these programs and how they're changing lives and how it's a good deal for government. Sam was talking about, the cost savings. I mean, you don't want to spend your time, just, hanging your hat on building a business case, but it is part of the discourse. It's part of the, it's part of the thing that convinces politicians that, oh yeah, maybe we should look at this program because, we won't have as many of these people in our emergency rooms. They're not going to be filling up hospital beds. Just overall, it's going to make a difference in the community where the money we put into this program we'll get back in other ways. So I think it's a continual, I guess, effort that's required to advocate for these kind of programs and for this population who live on the extreme margins of our communities.
Tim, now I'd like to give the floor to the audience. But before that, I'd like to ask you if you would like to add anything else, anything that you believe is relevant and that I haven't asked you or that I haven't covered. Would you like to, do you think something that has not been covered and that you'd like to mention?
Oh, you've done such a good job, Tony, that but I'm going to say just a practical matter, though, that I wanted to mention. Just around measuring fidelity, because, we're talking about fidelity. In our study in Canada, we had external teams come in, led by people like Sam, people who had knowledge of Housing First. And that has been a traditional way of assessing fidelity. And these were quite useful visits. So in Moncton, there were 2 visits at different times of the program, I think in the first year and then the 3rd year. And the team would come in externally. They would do some interviews. They would look at some charts, in terms of what services were being provided. They would just get a sense over a couple of days to what extent was this Housing First program in line with these criteria. So that's one way of doing it. But there's another way that's emerging now that I think is quite useful and that programs could look to doing as their own kind of continuous program improvement, and that's by doing a self-assessment. So the tool that's in your booklet is actually a self-assessment tool. And, programs as a group can do their own ratings around a Housing First approach in terms of the criteria, and then have a discussion about that and talk about where maybe the fidelity isn't as high as they would like or where there's program problems, what they can do to improve the program. And I think that's an important development. And related to that, we are doing a study across 10 countries, including with Arrels Foundation. They're involved with their programs, where we're doing these self-assessments. And what we want to do is really take a look across these very rich and different contexts, how people are managing the fidelity to Housing First criteria, and how the programs are different and how they're the same. And that should be quite interesting, just to see the variety of Housing First programs out there.
Bé, doncs, moltes gràcies.
Well, so thank you very much indeed. So now, if you'll agree, I'm sure there will be many questions for Tim.
Hola.
Hi, my name is Tim Aubry, and we are implementing a program at the City Council of Barcelona of Housing First. With regards to fidelity, Okay, there is the idea of including a person who has had the same experience in the teams. When it comes to implementing this in Canada, how was it done at first to include these people who have had that experience? Because at first, we do not have people who have gone through the Housing First process, but rather other processes. So could you tell us how you went about that?
Great, good. Gracias, thank you. That's a good question. This is a criteria in the last area of program structure, where you have on the team peer support workers, and they can be peer support workers who are part-time. And I will say, in Canada, in terms of our at-home chez soi project, we were late putting that in place. In fact, I remember at the Moncton site, the initial Fidelity assessment, there was nobody. We didn't have any peer support workers. I mean, the program was, was ramping up. And it was really only in the later portion of the 4 years that they actually integrated 2 part-time peer support workers. Now, it doesn't necessarily have to be people who've gone through a Housing First program. It can be people who have consumed mental health services, and they have that lived experience, and they can do the accompaniment, where they know what people have been through, and it might have involved some homelessness. So that's important. The other part that we found to be challenging, that had to be put in place, is how do you train people to be peer support workers? And that also delayed our involvement of peer support workers in the Canadian project. We had to put together a kind of training program, and the Mental Health Commission was involved in that, in doing that. But certainly it's an important criteria for Housing First, but not all programs, certainly initially, will have that in place.
Hola, bon dia. Jo soc Lourdes Arrels.
Hi, good morning. My name is Lourdes Arrels, and I also work at the City Council of Barcelona at the Department for caring for vulnerable people, Karma, and the rest of colleagues were implementing this municipal program right now. And well, my question is as follows. Do you believe that the traditional staircase model is compatible with a Housing First model? Or do you believe that ideally it would be to go to a Housing First model that only focuses on this chronic target population, but rather widened to the rest of the population that finds itself in this situation?
Thank you. I think there's a couple of questions there. One of the ideas, and I think it was proposed by Sam, just around the staircase model, and Sam explained that, where people have to go up the stairs. Sam has proposed you flip the staircase. So actually you start people with Housing First. And then if it doesn't work out, there's a really good, kind of test of whether or not people can manage. And we, as we've said, the majority of people will be able to manage, but there is a subgroup that won't be able to manage that. You have to look at other alternatives. But Housing First is clearly different than the staircase model. It collapses the stairs. I mean, that's the whole point. Now, you're not going up the stairs to get to your own housing. You're going right away. And I'll mention just what we did in Moncton. So I mentioned we had 125 people that were served. City about 100,000, but we also had a rural area. There were 25 people who were receiving Housing First. They weren't initially actually even homeless. Some of them were just adults, living at home. Some of them were living in these special care homes, you know, which are kind of quasi-institutional kind of facilities. But what we did, we had about 12 people who just couldn't settle into housing. You know, the people who it just wasn't working out, and they were going through multiple apartments. And it was mostly in Moncton, in the city. The rural stuff actually worked out very well. So what they did, the group there, that was, you know, overseeing Housing First, it was a partnership between several organizations, is they started out and put together a peer support, what they called a peer supportive housing program. They got an apartment block. There were 6 apartments in it, and they got a couple who actually had a family, but who had lived experience, who were the superintendents living on site, and they filled the other 5 apartments with people who had problems. It wasn't working out in Housing First. And there was more structure, there were rules. You know, if you were going to have a visitor over, they couldn't stay overnight, for instance, unless, you know, there was some kind of discussion about what that meant. The door was locked to get in, you know, because one of the big issues is apartment takeovers, parties in apartments, and so on. There were just more rules, okay? So that was kind of how they dealt with, you know, kind of, okay, Housing First, it doesn't work out, we'll put in place this peer supportive program. And today, they actually have 2 of those programs. So they've got 2 of these apartments like that. So that's flipping the staircase. You start with Housing First, doesn't work, you go to a more structured model. The second question is it just for people with, you know, that have a history of chronic homelessness? Here's what I think about that. I think actually, and it's kind of one of the neat things when you look at program fidelity and you've got the criteria, I think you can actually pull from Housing First and adapt it to different populations. Like Sam talked about rapid rehousing, where people just get the rent supplements, okay? There's a big study just finished in the US with families. And they actually got this rapid rehousing, a rent supplement, and a little bit of support to help them move out of homelessness. It wasn't, you know, for a year, it wasn't for 2 years, it was only for a few months if needed. That's a kind of pulling some of the Housing First pieces and putting them in place. And here's the thing, and I think this is what's so attractive about the approach, and if actually we can solve homelessness for, you know, people who have the most complicated lives, the most complicated histories, the longest periods of homelessness, whose homelessness does not seem solvable, and if we can actually put the package together to do that, that should work for anyone. And in fact, we don't need all the elements for people, you know, whose homelessness is strictly poverty. It's not, you know, their personal vulnerabilities, their health issues, and so on. So I hope I've given you some things to think about in terms of, thank you.
Hi, good morning. My name is Francesca Ciencio. I'm one of the psychiatrists who is working with the Housing First program. And, okay, here in Catalonia, the psychiatric reconversion is very difficult, just like in other countries. But in our experience, with the people with serious mental pathologies, your studies and Sam's studies do point out to the fact that people are less hospitalized. There are less non-voluntary hospitalizations. But I'd like to ask you, the moment one of these people needs to be hospitalized, how do you manage that? How many non-voluntary hospitalizations do you have, if you have any? Are they all voluntary? Or is there a specific point where these people, or a place where these people are hospitalized, or they are just hospitalized in the city's hospital networks? Tell me about your experience about when somebody needs to be hospitalized. If it's a long hospitalization period, what happens to the housing unit? If the person needs to be in a therapeutic community for 3 months in a hospital, what happens? Will the staff go and visit him or her at the hospital? Tell me about that, please.
No, that's a very good question. That's in our project, first of all, and there's a reason for this, we had actually very few hospitalizations. In part because we deinstitutionalized and we closed our psychiatric institutions, and the number of beds we have for mental health problems in hospitals has really gone down. It's very difficult to actually get hospitalized, okay? And it's even more difficult if you have a team working with you who are providing community support. Now, having said that, there were circumstances where people needed hospitalization, and they were hospitalized. Our services tend now to move towards short hospitalizations. It's a matter of weeks, okay? And then, now, what's important, though, is that there be collaboration between the Housing First staff and the hospital staff, okay? So the partnering that goes on between the Housing First program and mental health services, the psychiatric services, is critical for people to navigate, from a Housing First program into hospital and then out of hospital. So you have to set up those kind of partnerships. And that contributes certainly to program fidelity, those partnerships. Now, the principle is, though, if people go to hospital, it's like everybody else, they don't lose their apartment. The apartment is where they live. They just happen to have a hospitalization. So even if it was for a month, 2 months, 3 months, the apartment would stay there, and that would be where they would go. They would go back. So it's kind of an important issue, and I know it's going to vary depending on the country, the extent that hospitalizations are used as a way of helping people and stabilizing people and so on. But the relationship with the main mental health system for Housing First programs is really critical. And the Moncton Project, again, I talked about the Moncton Project just because I had the most contact and exposure to it. They had 2 psychiatrists that provided consultation and who had links to the 2 hospitals that had psychiatric wards in the city of Moncton, so that they were able, if necessary, and the small number of times that it happened, they were able to coordinate the hospitalization so that it was workable, and people didn't stay too long, and they worked on a discharge plan that the team could be aware of and help put in place.
Hola, buen día. Bueno,
Hi, good morning. My name is Laia Martin. I also work with the City Council of Barcelona in a Housing First program. And I'd like to ask you 2 questions. First, people talk a lot about a weekly visit as part of the commitment. What happens when people do not accept that weekly visit when they're at home in their house? And the second question, have you found situations of pregnant women? How have you approached the pregnant women situation and the family? Thank you.
That was a kind of minimum requirement for the programs, and it tends to be where you have a weekly visit, and it's 15 and 20 minutes. The reality is there's times when people don't want to see program staff. They haven't engaged maybe with the program, and that becomes part of the work that the program staff has to do, is, you know, that building a relationship. But it's a negotiation, and it's a kind of a constant negotiation. And again, what I was saying earlier, you know, you're pushing the envelope. You're trying to take people, and you're trying to, you know, do it in a way that allows people to have as much choice and autonomy, including, you know, the receipt of services. The issue of pregnancy, I mean, I think you know that you would work with it. You would want to work with it in the same way. Now, I will say, I'm not familiar. I don't think it came up certainly in the Moncton program in the 125 people, but it will come up for sure. But again, you know, you've separated housing and supports. So now the task is you want to find the right supports that can help make sure that it'll be a healthy pregnancy, that things will work out, that the new mother will have the support needed to take care of the baby, and so on. But the housing should stay the same, or if for some reason the housing has to change, then you'd work with the person to change the housing. But I would see actually housing first, given the complement of services. It should be able to manage that, you know, quite well. It obviously is going to require more involvement of primary care kind of services.
Bé, Tim, crec que no tenim més temps.
Well, Tim, I think time is up. I think time is up. We have no more time to celebrate. I'm very happy. It was a very, very fruitful hour. Thank you very much for your time and your capacity.
And thank you for your interest and engagement. Thank you.